Every day, seniors are told, that's just age. You're supposed to feel tired, achy, and a little forgetful. But what if that's not aging at all? What if one hidden deficiency is quietly wrecking your body and mind, and the fix is shockingly simple, if you catch it in time? Today, Dr. Harper reveals the hidden vitamin that could change the way you age, and the urgent step your doctor might not be taking. Listen carefully. By the end of this episode, you'll have a brand new roadmap for senior health. You know, Dr. Harper, I was at my friend Margaret's house last week. She's always been active, but now at 76, she's started canceling our walks. She says she just doesn't have the energy. She's also been misplacing things, and her daughter is worried it's just old age. It feels like this is the story for so many people I know. Is it really always age, or could there be something else going on?
Susan, I'm glad you shared Margaret's story because it's almost a blueprint for what I see every week. Seniors feeling more tired, more foggy, a little weaker, a little sadder. The narrative is always, that's just part of getting older. But here's the truth. A surprising number of those symptoms have nothing to do with age itself. There's a hidden culprit, one that hides in plain sight, one that even doctors overlook if they're not looking for it.
I have to be honest, when you say hidden culprit, it makes me nervous. Can you tell us, what are we missing?
Absolutely, and I want every listener to feel empowered, not afraid. We're talking about vitamin B12 deficiency. Now, you've probably heard of B12 in passing. Maybe you've seen it on supplement shelves. But here's what almost nobody tells you. Even if you eat what looks like a healthy diet, even if you've never had a problem before, your ability to absorb B12 drops dramatically after age 60. And the symptoms? They're sneaky. Tiredness, muscle weakness, balance problems, even memory loss. A recent study from the Journal of the American Geriatric Society found that up to 1 in 5 seniors has clinically low B12. Even more, almost 40% have low normal levels that can still cause symptoms. What's worse, most annual checkups don't include a B12 test unless you specifically ask for it.
I just described half the people at my community center. Tired, forgetful, sometimes even depressed. Are you saying they might just be missing this one vitamin?
Exactly. Let me share a case from last month. An 81-year-old man, retired engineer, came to me because he'd started falling for no clear reason. He said he just felt off balance, and his doctor told him it was old age. But when we checked his B12, it was dangerously low. Within a month of B12 shots, his energy came roaring back and his falls stopped. There's a direct connection between B12 and the nerves that control your balance and memory. And this isn't just anecdotal. A 2013 Harvard review showed that correcting B12 deficiency in seniors led to significant improvements in memory and strength, sometimes within weeks.
That's incredible and, honestly, a little frustrating. If it's so simple, why aren't doctors catching it? Why isn't this part of every senior's yearly blood work?
That's one of the tragedies, Susan. The medical system is great at treating symptoms, but not always at finding root causes. B12 testing isn't standard for most annual exams. Plus, many doctors assume if you eat animal products, you're safe. But age, medications, and even mild gut issues can block absorption. Here's something from the Mayo Clinic proceedings. In seniors over 65 taking acid-reducing meds for heartburn, the risk of B12 deficiency is double compared to those who don't take it. And anyone on metformin for diabetes, same story, much higher risk.
That's me. I take omeprazole for heartburn almost every day. Should I be worried?
That's a perfect example. If you or any senior are taking acid blockers or diabetes meds, you should absolutely have your B12 checked at least once a year. And for everyone listening, here's a quick at-home check. If you notice new tingling in your feet or hands, trouble with balance, sudden forgetfulness, or just unexplained fatigue, don't write it off as just getting older. Those can all be early red flags.
It's scary how much can be hidden in plain sight. So, what does someone do if they suspect they have this deficiency? Can you just start taking supplements, or is it more complicated than that?
That's a crucial question. B12 is water-soluble, so it's generally safe, but not all forms work equally well, especially in seniors. For mild cases, high-dose oral supplements may help, but for many people over 65, especially those with symptoms, the body just can't absorb enough through the gut. That's why injections are sometimes needed to really restore healthy levels. But here's a twist most people don't know. Even blood tests can miss early deficiency if doctors only look at the normal range. You want your B12 over 400 picograms per milliliter, not just above the minimum cutoff. And here's another open loop for everyone listening. In a moment, I'll share the simple 2-sentence script you can use with your doctor to make sure you're tested and taken seriously, plus the at-home pencil test for early nerve issues that anyone can do today.
Dr. Harper, you have my attention. I'm definitely thinking of a few friends who need to hear this. You mentioned depression and mood. Can B12 really affect your mind and emotions too?
It's not just possible, it's proven. In a large 2022 Lancet study, seniors with low B12 had a 70% higher risk of depression and twice the rate of anxiety. The brain relies on B12 to produce neurotransmitters, basically the happy chemicals. And because deficiency is so gradual, people often live with low mood for years without knowing there's a fix.
This is hitting close to home for me, and probably for a lot of people listening. But can you clear up one thing? If B12 is so essential, why don't we hear about it as much as, say, vitamin D or calcium?
That's part of the hidden crisis. B12 is a quiet vitamin. The symptoms build slowly, and doctors aren't trained to watch for them in older adults. And to be honest, there's no big pharmaceutical lobby pushing awareness. Yet a deficiency can rob someone of their independence and joy. Here's a shocking stat. A 2024 NIH summary found that up to 60% of early dementia diagnoses in seniors are actually reversible, with B12 correction as the main factor.
You're telling me some people are being told they have dementia when it's really just a fixable deficiency?
Yes, and it's heartbreaking. I want every family member, every senior, to understand this. You have to be your own advocate. Doctors mean well, but you have to ask directly for a B12 check. Don't assume it's routine.
That's huge. I want everyone to remember that. Ask for the B12 test. Dr. Harper, you promised a pencil test for early nerve issues. Can we share that now?
Absolutely. Here's what you do. Close your eyes, hold your hands out, and have someone gently brush a pencil eraser along your foot. If you can't feel it, or if it feels funny or numb, that could be a sign of early nerve damage from low B12. It's not a diagnosis, but it's a reason to push for further testing.
That's so simple and honestly empowering. We all want to feel like we have some control. But here's my big worry. Once you've lost memory or balance, is it too late, or can fixing B12 really reverse the damage?
That's a life-changing question, and in a moment, I'll share a case where a senior went from wheelchair-bound to walking again just by fixing their B12. But first, let's talk about the doctor doesn't listen problem and how you can make sure you're truly heard at your next appointment.
That's a situation so many people can relate to, Dr. Harper. I know a lot of seniors who say, my doctor just shrugs and says it's normal for my age. It can feel dismissive.
But if someone is worried about B12 and their doctor isn't listening, what do they do? How can you be assertive without feeling like you're doubting your doctor?
It's such a real concern. Most doctors want to help, but the average primary care visit is less than 15 minutes, sometimes only 7. It's easy for things to get overlooked. But here's the truth. You have the right to advocate for yourself. Here's the 2-sentence script I give all my patients. Write this down if you can. I've read that B12 deficiency can mimic aging and cause memory, balance, or mood problems in seniors. Could we please check my B12 levels and talk about my results in detail? Just saying those words changes the dynamic. It signals to your doctor that you're informed, and it focuses the conversation on specifics, not just, I feel tired. Most good doctors will listen if you're direct.
I love that. It's simple, respectful, and direct. I wish I'd known this when my mom started acting different a few years ago. I wonder how many listeners are thinking about a loved one right now.
I see it every day. I'll tell you about Evelyn. She was 82, came in using a walker, had been told it was arthritis and age. Her family thought she was slipping mentally, but she wasn't confused. She was exhausted, numb in her feet, and quietly scared. Her B12 was critically low. We started injections, and within 2 months, she was back to walking on her own, her wit and spark returning. She brought me a thank you card that said, "Thank you for giving me back to myself." A recent British Medical Journal study in 2023 showed that in seniors with memory problems, over 30% improved significantly after B12 treatment, sometimes enough to change their diagnosis.
That's an incredible turnaround. And I want to highlight something. This isn't about miracle cures, is it? It's about finding what's actually wrong and treating it, not just accepting decline.
Exactly. The worst thing we can do is shrug off new symptoms as just aging. Real aging happens, of course, but real disease needs real treatment. The big tragedy is when something reversible like B12 deficiency is left to cause permanent damage. Another study, JAMA Neurology 2022, showed that every year B12 deficiency goes untreated in older adults, the risk of irreversible nerve damage goes up by 10%. That's why early recognition is everything.
I'm thinking about what you said earlier about falls, confusion, and even depression being connected. If someone's been living with these for a while, is there hope for recovery, or do the changes become permanent?
There is almost always hope, especially if you catch it early. The nervous system is resilient, but it does have limits. In some cases, memory and strength return dramatically. In others, symptoms stabilize and stop getting worse. Either way, catching B12 deficiency is never wasted effort. I want to share a little-known fact. The American Journal of Clinical Nutrition reported in 2023 that seniors who corrected low B12 not only felt better, but had a 30% lower rate of hospital admissions for falls and fractures over the next 2 years. That's a huge difference for independence and quality of life.
I wish more people knew about this. Let's say someone's listening right now. They're worried, maybe they have some symptoms, maybe they're caring for someone who does. What's the step-by-step? Can you walk us through exactly what they should do, from talking to their doctor to getting the right treatment?
Absolutely. Let's lay it out. First, make an appointment specifically to talk about energy, mood, and memory, not just routine labs. When you see your doctor, use the script we discussed. Ask for a serum B12 test and also mention methylmalonic acid or homocysteine if possible. These catch cases that regular B12 blood tests miss, especially if your numbers are borderline. If your B12 is under 400, ask for advice about the best way to restore it. For many, that means high-dose oral supplements. For others, especially with symptoms or if you're taking medications that block absorption, injections are often best. And please don't settle for your numbers are fine if you still feel off. Push for answers.
I really appreciate how practical this is. It's empowering to know exactly what to say and do. Now, let's talk about supplements for a moment. The vitamin aisle can be overwhelming. Do all B12 supplements work the same? Are there differences that matter for seniors?
That's a crucial question. B12 comes in a few forms. Cyanocobalamin is the most common, but methylcobalamin and hydroxycobalamin are better absorbed by many seniors. Look for sublingual, under-the-tongue tablets if you're using oral forms. They're easier for the body to absorb. And always check the dose. For most older adults with low levels, you'll need at least 1,000 micrograms a day by mouth, or whatever your doctor recommends if you're on injections. But I want to stress, you can't out-supplement a medical problem. If you have real symptoms, don't just buy a vitamin, get checked.
That's important. And what about food? Can you eat your way out of a deficiency, or is that not enough?
Diet absolutely matters. B12 is naturally found only in animal products, meat, eggs, dairy, fish. For some people, eating more of these helps, but after age 60, the body's absorption machinery often breaks down. A 2024 Yale Nutrition Review found that even seniors who ate meat daily had a 20% rate of B12 deficiency due to absorption issues. So food is good, but don't count on it alone, especially if you have any risk factors.
You mentioned earlier about the role of gut health and certain medications. Can you walk us through the biggest risk factors so people know if they're more vulnerable?
Absolutely. Here's what to watch for. Age over 60, absorption declines naturally. Use of acid-blocking drugs like omeprazole, lansoprazole, etc. Metformin for diabetes. Chronic gut issues like Crohn's, celiac, or IBS. Past weight loss or stomach surgery. Strict vegetarian or vegan diet without supplementation. If you check any of those boxes, you need to be proactive about B12. And even if you don't, but you have symptoms, get tested anyway.
It's incredible how common these risk factors are. Let's open up another issue, emotions. A lot of seniors I talk to feel embarrassed to bring up memory or mood changes. They don't want to seem crazy or weak. What would you say to someone who feels ashamed to talk about these things with their doctor?
That's such a human reaction, but it's vital to remember memory, mood, and energy changes are medical symptoms, not moral failings. You wouldn't hide a broken bone. Don't hide brain fog, sadness, or tiredness. The stigma only delays help. A Stanford geriatric psychiatry study in 2023 found that seniors who brought up cognitive or mood changes had twice the chance of getting the right diagnosis and treatment, and their families reported much higher satisfaction with care.
That's a powerful message. You know, all this talk about memory and mood makes me think of one of my neighbors. Her husband went downhill so fast, everyone thought it was Alzheimer's. Turns out it was B12 all along. She said, "I wish I'd known earlier. He lost 2 years to confusion that didn't need to happen." It really is about catching it in time, isn't it?
It is. And that's why I want to leave listeners with another open loop. In the next few minutes, I'll share the red flag checklist I use in my own practice. The subtle clues that most people, and even some doctors, miss when B12 is running low. Plus, I'll tell you about a case that nearly fooled even me, a senior with a perfect blood test, whose real problem was hiding in plain sight. But first, Susan, I want to talk about what families can do, because loved ones often notice changes before the senior does.
Yes, let's go there. A lot of us have parents or partners who are stubborn, who don't want to go to the doctor or admit something's wrong. How do you support someone you care about without making them feel nagged or embarrassed?
It's a delicate balance. Start by sharing your concern out of love, not fear. Say something like, "I've noticed you seem a little more tired lately, and I read it could be something simple like a vitamin. Would you mind if we checked with the doctor together?" Sometimes just knowing someone cares enough to notice makes it easier to take that step.
That's practical and kind. Dr. Harper, you promised us a red flag checklist and a story that even fooled you. Can we get into that now?
Absolutely. Here's the checklist I use for B12 undercover cases. Sudden drop in energy without a clear reason, new forgetfulness or trouble finding words, balance problems or unexplained falls, tingling or numbness in the feet or hands, mood changes, irritability, depression, or anxiety. If any of those pop up, don't chalk it up to age. Investigate. Let me tell you about Frank, a 73-year-old retired teacher. He came in with what he called old man clumsiness. He'd started tripping, dropping things, missing steps. His wife told me he's not himself. When we ran the right tests, his B12 was dangerously low. After a series of injections, it was like someone turned the lights back on. He got his energy, his humor, his sense of balance. Frank started teaching part-time again, helping at his church, even going fishing with his grandkids. His wife said, "I have my husband back." It's stories like that which keep me fighting for awareness.
That's beautiful and so real. I can imagine listeners picturing someone in their own life, wondering if there's still time to help. Can we talk about time for a second? If someone's been deficient for years, is recovery always possible? Or are there cases where damage can't be reversed?
Great question, and it's one I'm honest about with every patient. The sooner you catch it, the better the outcome, especially for nerve symptoms and memory. If damage is severe and long-standing, some changes might not fully reverse, but there's almost always improvement. For many, even stabilizing symptoms or stopping further decline can transform quality of life. And here's something rarely discussed. Even in cases where physical symptoms linger, mood and energy often rebound quickly. That sense of being present and clear again is incredibly valuable.
That's such a good reminder. Even small steps forward can mean the world when you feel like you're losing yourself. I want to pivot for a moment. We've talked about B12, but you mentioned earlier that it's not the only nutrient seniors struggle to absorb. Are there other deficiencies that can sneak up and cause similar issues?
There are, Susan. B12 is the most dramatic for nerve and brain symptoms, but other deficiencies like vitamin D, folate, and even iron can also cause fatigue, weakness, and cognitive changes. What's unique about B12 is just how silent and far-reaching the effects can be. But the real lesson is this: as we age, our bodies change. Absorption gets less efficient. Routine, normal tests don't always catch subtle deficiencies. That's why it's so important to ask questions, track changes in how you feel, and push for thorough testing when something doesn't add up.
So it really is about being proactive, not waiting for someone else to notice or for things to get bad enough to see a specialist.
Absolutely. Seniors and their families are the front line of their own health. If something feels different, if you feel more tired, down, or off balance, don't wait for an annual checkup. Make an appointment. Ask for B12. Ask for a real conversation. And don't let anyone tell you it's just your age if you feel something's wrong. Age is a factor, but it's never the whole story.
I want to talk about families for a second. You've mentioned the importance of support, and I know a lot of adult children listen to this show hoping to help their parents. What's the best way for families to help without taking over or making seniors feel helpless?
That's such a thoughtful question. The best help is collaborative, not controlling. Start conversations with curiosity, not criticism. Share what you've learned. Offer to help with appointments and listen to concerns. Sometimes just being present at a doctor's visit helps seniors feel heard. And for families, remember, sometimes you'll notice subtle changes before your loved one does. Don't ignore them. Bring them up gently and keep an open mind. Here's an actionable tip. Keep a notebook or calendar to track symptoms or changes together. That makes it easier to spot patterns and to show the doctor real data if you need to push for more testing.
That's such good advice. I know some listeners still feel unsure about bringing things up to their doctor. Maybe they've been brushed off in the past. Can we role play for a moment? What would you say, as a patient, if your doctor seems dismissive?
Of course. If your doctor says your labs are normal and you still feel bad, try this. Doctor, I respect your expertise, but I know my body and I'm noticing changes that aren't normal for me. Could we dig a little deeper? Maybe check my B12, vitamin D, or other nutrients. I'm willing to do more testing if it might help me feel like myself again. That kind of language is respectful but assertive. It puts you in partnership with your doctor, not in opposition.
That's empowering. Dr. Harper, as we come toward the end, what's the number one thing you want every senior and every family member to remember from this episode?
Never assume decline is inevitable. If you or a loved one is struggling with energy, memory, mood, or balance, don't accept just aging as the answer. Ask questions, get tested, and never settle until you feel heard and understood. And if you discover a B12 deficiency, know that recovery is possible, sometimes dramatic, but it starts with you.
Thank you for that. Before we close, I want to let listeners know we'll be back next week with an episode on a hidden threat almost every senior faces: silent bone loss. We'll reveal how to spot it early, what your doctor might not be telling you, and the simple habits that protect your strength for years to come.
That's going to be a critical discussion, Susan. Bone health is often ignored until it's too late, but it doesn't have to be that way.
Dr. Harper, thank you so much for your wisdom and care today. I hope everyone listening feels a little more confident, a little more hopeful, and a lot more prepared to take charge of their health.
If you found this episode helpful, please share it with someone you love. Subscribe so you never miss these critical conversations. And remember, even one simple question at your next checkup could change your entire future. Take care, everyone, and we'll see you next week on Senior Nutrition and Health.